Hello, my name is Michael Lunzer, and I'd like to talk with you today about the importance of taking action to improve and streamline prior authorizations. As I talk with health plans across the country, I find that a number of them are improving their prior authorization processes. I have also seen that far too many are waiting for final regulations from CMS or state government before they improve their systems. There are a number of improvements all health plans can make that are complementary to the various regulatory proposals that are in process. Today, I'd like to discuss the opportunity cost of waiting to improve prior authorization processes and things that can be done by health plans now to improve member and provider experience while reducing the administrative burden for the health plan. We've all read many of the articles in the press about how provider burnout is causing a stress on the healthcare system. One of the big factors in provider burnout is the prior authorization burden. Multiple surveys have shown that providers are reporting care delays, abandoned care, and oftentimes serious adverse events on patients. These care abandonments are a big financial impact for the provider and a significant care driver for the patient. In addition, we've seen a number of articles about how hospitals and health systems are dropping Medicare Advantage plans from certain payers due to the administrative burden that's added through those Medicare Advantage plans. These market impacts have caused a dramatic amount of regulatory pressure to fix this prior authorization problem. CMS proposed a regulation in December of 2022. Multiple state organizations and legislators have proposed and in some cases passed rules to improve prior authorization, including things like improved response time requirements, gold carding, and within the CMS regulation, they've proposed a new technical interface that payers need to provide and make available to providers so that prior authorizations can be processed within their electronic medical record systems. So what can be done? Recently, in a presentation by the AMA, Dr. Marilyn Heine mentioned that over 60% of physicians said it's difficult to determine whether a prescription or medical service requires a prior authorization. Think about that. It's hard to believe that health plans can't make it easy for the provider to know. The first thing that they need to do when they're working through the care provisioning for a patient is determine if their health plan covers a benefit and requires a prior authorization. Once they determine if it requires a prior authorization, they need to know what do they need to submit to get that prior authorization approved. Many health plans support this request with very difficult to use spreadsheets and PDFs on their websites. Itiliti Health provides a tool called PA Checkpoint that is a software as a service database that the health plan can maintain and manage to communicate their rules around what requires a prior authorization. Those rules can be configured at a very granular level, all the way from a line of business level down to a specific contract with a commercial client. This makes it really easy for the provider to quickly go out to the health plan website or provider portal and know if a prior authorization is required. Itiliti Health also provides a product called Medical Policy Management that's integrated with PA Checkpoint. And that makes it easy for the provider then, in addition to knowing if a prior authorization is required, to know what medical policy applies and what are the clinical requirements, what needs to be submitted for a prior authorization. To give you an example of the impact of this type of system, Blue Cross and Blue Shield of Minnesota implemented PA Checkpoint and Medical Policy Management back in 2020. The first year, they found that prior authorization submissions were reduced by 30%. Now think about that. This is a pain point that so many people are frustrated with. Prior authorizations are a big topic of discussion, and we can remove 30% of the burden from providers and patients just by making it easy for them to know that they don't even need one. If they do submit a prior authorization that doesn't need a prior authorization, they're still waiting for a response back from the payer. Oftentimes that response is queued up in the normal workflow and can still take a week to get back or two. In addition to avoiding many prior authorization submissions, PA Checkpoint and medical policy management reduced call center traffic by 20%. Because now providers have an easy way to go to the health plan website and get an accurate answer of whether or not a prior authorization is required. In addition, the call center now uses this tool, and all internal health plan resources use this tool to know what are the rules for a particular patient, procedure, on a particular date and time. Another client experience with PA Checkpoint is Blue Cross Blue Shield of Wyoming. In their case, they found that confusion around these rules created a dramatic, unnecessary burden. Poor communication within their old system caused there to be over 13 disputes per 100,000 members per month around whether or not a prior authorization should have been pursued. After implementing PA Checkpoint, that dispute level went down to 1 dispute per 100,000 members per month. And the impact of that is pretty dramatic. $3 million per year of savings per 100,000 members, just by making it clear whether or not a prior authorization is required. So to go back and refresh, these are the two elements that are available from Itiliti Health to help address this critical challenge at the very front end of the prior authorization process. So the next question is, how are those consistent with what's coming from a regulatory perspective? Well, first of all, let's talk about gold carding. With gold carding, a health plan is required to communicate to the provider whether or not they're required to proceed for a prior authorization for a particular service. In other words, a provider did a really good job for the last 6 months, and now they don't need to use prior authorizations for a particular service for the next 6 months. Typically, the health plan sends a letter to the provider gets that letter, but they don't have a system that makes it easy for them to store that letter in the context of procedures and health plans. So ultimately, that creates an added level of confusion. In some cases, a provider admin assumes they're gold carded for procedures they're not. In other cases, they call the health plan to find out if they're gold carded for a particular procedure. Or they just submit prior authorizations and ignore the gold carding process altogether, which actually creates an additional burden for the health plan because now they need to communicate back to the provider, you didn't need to submit that prior authorization. So by putting those gold carding rules into PA Checkpoint so that a provider can easily and quickly determine, do I need to submit a prior authorization for this procedure and this patient, or am I gold carded in real time during their normal workflow? That avoids a tremendous amount of pain and time required in the prior authorization process. So how are these Itiliti Health products consistent with the CMS direction? Well, CMS has basically broken down the prior authorization transactions into 3 categories. First is CRD, or is a prior authorization required? The second is DTR, documents, templates, and rules. But ultimately, that means that the provider needs to be communicated to around what are the clinical requirements for a medical policy. Itiliti Health addresses these 2 problems with a source of truth, PA Checkpoint and medical policy management. And both of those tools can be interfaced to the Da Vinci standard in support of those 2 rules. They can also be interfaced with other companies' products that might take a role in this process. So by implementing PA checkpoint and medical policy management, you're able to achieve significant savings today, while at the same time being consistent with what's coming from the regulatory perspective. Itiliti Health also has products that help the payer review prior authorizations once they come through the process, if they cannot be automatically approved within the CMS, the new CMS standard. So what are the costs of waiting? For a typical small health plan, in the neighborhood of 150,000 members, it's almost $1 million in administrative savings. And as we illustrated with Blue Cross Blue Shield of Wyoming's case study, it's an additional $3 million of care costs per year. For a health plan in the neighborhood of 700,000 members, it's around 2.2 million of admin savings. And imagine the savings on care when we extrapolate the savings per 100,000 members from Blue Cross Blue Shield of Wyoming. And then for a health plan of 2.5 million members, there's an additional $5 million of cost savings in the admin category. And this is not only helping the health plan. There's an equal reaction or savings on the provider side. So just a little bit about Itiliti Health. We were founded in 2018. We've built a very strong platform that supports the medical policies and rules for the health plan and allows those to be easily communicated to providers. They can be communicated through the public website of the health plan, through a provider portal, or through various EMR integrations directly to the provider in their normal workflow. Last year, in 2022, we did over 2 million PA checks, and the system was highly reliable. For that reason, Gartner, IDC, and KLAS have all given us great accolades for the work we've done in prior authorizations. We'd love to talk with you more about how we can help your organization improve your prior authorization processes. Thank you for the time to talk with you today, and we'll look forward to hearing from you at Itiliti Health.